Did you know that worldwide obesity has nearly tripled since 1975? In 2016, more than 1.9 billion adults 18 years and older were overweight. Of these, over 650 million were obese.
This is Dr. Jonathan Youssef, networking for your optimal health.
No, this is Brittany, PA student, networking for your optimal diet.
Hi, this is Dr. Jonathan Youssef, networking for your optimal health. Today's topic is...
diet.
Perfect. And with me today is Brittany from South University, and she's going to talk to us a little bit about diet. So I'm kind of going to just let her free flow and let us know what research she's found and what she recommends are some of the best diets out there.
All right, so one thing that I noticed in modern times is there's a lot of different diets that people adhere to. So to start off, I just wanted to talk about some of those different diets to briefly touch base on them. I have about 4 or 5 diets here that a lot of people may know about, but I'll just go over them in some short detail. So to start off, we have the Atkins diet, really similar to the keto diet, which a lot of people have heard of. It emphasizes low carbohydrates, but the only difference between this is over time they want you to gradually increase your carbs. So you start off with 20 grams and then the next week you may go up to 25, 30, so on and so forth. With the keto diet, you just have the low carbs and you kind of adhere to the low carbs, high fats, fruits and vegetables for a longer period of time. With the zone diet, that focuses more on staying within a certain range for each major food group. So you have 40% carbs, 30% fat, 30% protein. So how much you eat doesn't necessarily change, but what you eat is more modified with the zone diet. A lot of people know about the vegetarian diet. So you cut out most animal products. You have the lacto-ovo vegetarians who will still have dairy products and eggs. You have the vegans who cut out all animal products, and then the raw diet, which cuts out not only animal products, but also only adhering to raw foods, so not really cooking their foods. You do have some raw carnivores, which will still eat meat, but not cook their meat, which was a little bit beyond me. So yeah, those are some diets. Ones that are recommended by most doctors is the Mediterranean diet. These tend to model the eating habits of countries like Greece, Italy, Spain, and France. And there's a huge emphasis on eating foods like fruits, veggies, lean meats, foods from natural sources. So really cutting back on processed foods.
Excellent. That's a really good summary of all of the diets. Is there any particular one that is specific for particular patients, or how does it work out? From what I understand, many a times I've heard people with certain types of body types may benefit from certain types of diet. Also, I've heard that maybe perhaps there was some theories on which area of the country you sort of grew up in, or your generation or your ancestry had been brought up in, and that ancestry determined which diet was best for you. Is there any truth to this, or is there any benefits to looking into that?
I do think that culture does play a huge impact on the type of diets that people adhere to. So even personally speaking, in my own culture, we make a lot of like foods like legume. We make a lot of rice. We do consume a lot of animal products. And so, someone who comes from my country of Haiti might benefit from something like a zone diet where their foods might not necessarily, change, but how they configure their plates might change. Something you said I want to touch base on is which foods might benefit certain people with certain conditions. The keto diet has been shown to really aid people who have conditions like epilepsy, but can be a little bit harder on somebody who's like a diabetic because of the toll that it can take on your kidneys, the dangers of having ketones in your bloodstream if you are diabetic, which can send you into something called ketoacidosis. So you have to be careful with the diets that you adhere to based off of your medical conditions, but some of them can really help with different things.
I agree. I believe that not every diet is appropriate for every patient, and also you have to make sure you discuss those with the with your medical conditions to your physician and provider to determine what best diet may be suitable for you. In the cases of diabetics, you hear about this 1800 calorie diet, or you could even go 1600 or 2000 depending on the patient. How how is this important for patients who have diabetes?
Well, a major thing with diabetic patients is having control over their insulin levels. So, glycemic control, making sure that you're not having huge spikes throughout the day, huge crashes throughout the day, which can happen in some high calorie diets or even be detrimental in lower calorie diets that are, below the 1600. So, the 1600 to 1800 threshold really can help a diabetic patient stay within range of their blood sugar levels, I believe, to really be beneficial in long-term course for a diabetic, because that sugar control over a long period of time can help stabilize their levels. And so kind of adhering to that caloric level can limit what foods that they eat and how much of it that they eat and keep them within range.
What I wanted to kind of add at this point is sometimes I think that it can be very overwhelming to remember all of the diets and how to function. So I have my patients start with some simple, let's not do this kind of diet. So the first thing that I tell them is avoid sweets.
Yeah.
There's really no benefit in sodas, sweets, candies, chocolate type things. That dark chocolate might be okay, but certain types of sweets essentially have very little to no nutritional value. So that's the first thing I tell them. The second thing I am pushing for is cutting out those white, enriched, bleached flour that you see in a lot of our foods, for example, bread and pasta. So that's the second thing I tell them. If you can start cutting out your simple sugars, cut out those breads, and specifically the kind of bread and pasta that might be found with or made with white enriched bleached flour, may be very, very harsh on your body and very low in nutritional value. So those are the two things. If they can start off with those things, essentially I've seen people lose 5-10 pounds within a couple of months of starting that kind of a diet. Portion control, I think, is very important as well. So limiting the amount of the portions that you have has a strong impact. One of the things that I found very beneficial for many of my patients is a do not eat list. And this essentially helps my patients really restrict what they eat in a more focused fashion. Because sometimes you'll have a ton of food on your plate and you're hungry and you want to eat all of this in one sitting. But when you have a do not eat list of things, you could definitely have more control of what not to eat on that plate and still kind of help yourself diet and improve your weight loss by doing so. There's also diets that maintain weight, and there's diets that help you lose weight. Is there any specific things that you can think of that may be more of a maintenance type diet rather than a weight loss diet?
So some maintenance diets may be things like the Mediterranean diet or like the zone diet, which, the zone diet specifically says it's not necessarily changing how much you eat, but it's changing what you may eat. So those types of diets that don't necessarily focus so much on calorie restriction, but more so just the modification of the foods that you eat, tend to promote a healthier lifestyle rather than, a focus on weight loss reduction. And that may be a consequence of, participating in those diets as well, that don't really focus on the calorie restriction, but, more so focus on, what you're consuming, what you're putting into your body.
I also believe that a lot of people are telling me, and I believe that diet is different than just lifestyle changes, because a diet seems like a temporary solution to someone's weight, but a lifestyle change essentially is a lifelong commitment to eating healthy. And so that's what I want to express to my patients, is that it's a lifestyle change instead of just a simple diet. And I think that there are ways in which we can help people maintain their lifestyle and a healthy lifestyle. And also there are some diets that are essential to helping them. I'd like Brittany to let us know maybe some of those things that we do here in the office and some of the things that she recommends to help people stay on their diet and be committed.
There's a couple of things that we do in office, and there's a couple of recommendations that I have. So I'll just try to touch base actually with the recommendations first, and then I want to, end on the note of what we do in office, just to kind of lead up to it. So just dialing a bit back on like the lifestyle changes and even portion control. One thing that I notice a lot with lifestyle changes is first identifying what your lifestyle is like initially. Something cultural for me is, having a huge plate of food set in front of me and not being allowed to leave the table until we finish our food. That can be kind of detrimental the older that you get, because your body's telling you that you're full, but you're still tending to overeat. So I'd say the first recommendation is listening to your body, listening to those cues. If you eat to the point that you don't feel well, maybe you should be dialing back on how much you're eating within that one setting. I like to adhere to the rule of eat enough so that I still have room left for dessert, but that doesn't mean I'm going to eat the dessert. So some of the things that we do in office to really aid in weight loss is, first, we do talk extensively about those lifestyle modifications. We do recommend the Mediterranean diet, definitely incorporating more fruits, veggies, lean meats, all those different things. And then on top of that, we offer supplements, so vitamin D, vitamin B12 shots. We offer probiotics. A really good brand that we use in office is we use the orthobiotics. People who are on certain medications can experience things like GI upset. So if you're taking antibiotics, birth control, alcohol, or even if you have a poor diet, so making sure that you have probiotics to make sure that things move more smoothly in the digestive system can really aid in that type of weight loss.
May I just interrupt with one particular, there are certain probiotics that are actually specific for weight loss. We found that certain strains of bacteria seem to help people lose weight, and there's a couple of products that have been sold for that particular purpose. So just keep that in mind when you're picking a probiotic, if you wanted it to help you lose weight, or did you want to help it build your immune system, or did you want to use it for building up or improving your gastrointestinal symptoms.
Yeah, that's good to know. To take it a step further, there are also some medications that we can offer in the office to aid in weight loss. I might screw up the pronunciation of these, but I know one that we do here, I believe, is Belviq.
There are several, yes. Belviq is a 5-HT2C inhibitor. It is a prescription medication for weight loss.
Okay. And then I know we also do phentermine here.
So the most written prescription for weight loss is phentermine and phendimetrazine.
Okay.
These are two stimulants that have strong regulations and will promote weight loss and reduce your appetite. Because they are so strong and because they're a stimulant, they may have some side effects and require weekly visits to our office with blood pressure monitoring. We even prepare an EKG and a blood test before you start, and we make sure that you're healthy and strong for the program. We do recommend the program for up to 3 months. Sometimes we can go a little bit over. Sometimes we can go under, depending on the patient's weight and their benefits that they're having from taking the medication. And those are evaluated on a weekly basis.
Okay. And then finally, I believe that we do Saxena here. I hope I'm saying that right, which can also be beneficial for type 2 diabetics as well.
Saxenda is an excellent medication. It's a GLP-1, and this medication is an injectable, though. It is a small injection in the abdomen, similar to what you would get like a small insulin, very tiny needle. And essentially, what it does is it gives you that feeling of fullness that you don't feel hungry with. It works on several aspects of diet. Oftentimes, when we diet, our brain is left behind. In other words, our gut is saying, "Okay, I've been dieting and I'm starting to lose weight," but our brain is saying, "Uh-oh, we are in a starvation mode. Let's get reset. Let's get back to our normal level." So let's say 150 is your normal weight typically for the last 5 years, and you start to go down to 140, 130. Well, your body's going to tell you you're going to need to eat more and save and store your food. You're going to try to go back. So in order to do that, we work on the medication Saxenda has essentially some benefits in working on the neurotransmitters in the brain, the GLP-1, which helps with getting the brain back on track with what that new reset point is. So hopefully you get down to 140 and you stay there instead of trying to get back to 150. So that's Saxenda.
Yep. And finally, we had a short discussion before we started the podcast about possibly even seeing a registered dietitian. I know I've had some friends ask me about, my opinion on that. So I also wanted to ask you your opinion on that as well while we're, on the show.
I definitely agree that registered dietitian, especially for those who are diabetic, I think especially for those who are very new to understanding their diet, not every diet fits every patient, and I think a registered dietitian can, guide you through to the right diet and educate you on what's the best long term as well. There's much research on diet, so I wouldn't jump to the conclusion that one diet is better than the other, but I would also use your best judgment and use a dietitian as an extra tool for figuring that out. I did want to mention there's two other products, prescription products. So there's one called Contrave.
Okay.
Contrave is a combination of bupropion, which is a medication we use for depression actually, and this bupropion is mixed with naltrexone, a second product. And naltrexone actually is a opioid blocker. Essentially, what it does is they work on the brain. Another tool to help with the addictive nature of food. So we found that using this combination has been as well effective for some patients. It may be important to note that people who are taking opioids or people who are sensitive, who have history of seizures, may also not be a qualifier for this medication. And please, again, talk to your providers about that. I believe that the last medication that I had put down, we let me just go review again: fendimetrazine, phentermine, Belviq, Saxenda, and then Contrave. I think those are all the ones that I've really seen beneficial. My second approach is to look at the hormones.
Oh yeah, yeah.
So essentially, the way I perceive the situation is that you could work on your diet and take these medications, but if your hormones are not in alignment, and hormones can range from your thyroid all the way to your testosterone, estrogen levels. There's also cortisol levels in the.
Yeah.
And for a short period of time, there was a ton of discussions and supplementation that was focused on cortisol levels, and that's what I'd like you guys to look at when you're going to your family doctor is, what are my hormones? So here's how I would start. Typically, thyroid is important. You have to make sure your thyroid is in alignment. Sometimes it's underactive, and that will have a huge impact on your weight, mood, as well as hair and skin. So very important. Estrogen is a female hormone primarily, but men can also have some estrogen. And estrogen has a benefit for hot flashes, mood swings, and night sweats, but it also helps with regulating the normal weight process in your body. So if you mix that with having that balanced with your testosterone, which is one that helps you keep muscle tone on and helps you with your energy and mood, you can with a nice balance of those two, you can improve your weight loss and essentially get back to the normal physiological healthy system, optimal system in your body. The last is progesterone. Progesterone helps with, again, hair and skin, and also helps with sleep, a very vital, important part of the weight loss program. In fact, you may be losing a lot of weight while you're sleeping. It's the regenerative portion of your body. So if you wake up and you haven't had a good night's sleep, you may be holding on to a lot more stress, fat, cortisol, and so on. And of course, the last thing is cortisol.
Yeah.
We tend to forget that. Of course, stress increases your cortisol levels. Caffeine increases your cortisol levels. So you may be fighting a losing battle by eating right and exercising, but then eating things and stressing to where your body doesn't want to let go of the excess fat. So those are 3 or 4 different ways that I would recommend focusing on your diet when you're dealing with sort of the medical side of it.
Yeah, definitely talk to your doctor about, especially if you're struggling to lose weight. Some of those hormone levels can be really indicative of something else that may be going on that may be outside of your control and may need, further management to see the results that you're looking for, on top of feeling better.
Yes, excellent. I think that, concludes our session, weight loss. We were really happy. Brittany did a great job and appreciate you coming aboard to talk about that. So hopefully we'll be there for a couple of more topics, and we'd like to join us for more Optimal Health podcast. So this is Dr. Jonathan Youssef, Networking for Your Optimal Health. Thank you, Brittany.
Absolutely.